You're listening to Puma Podcast.
For many underprivileged Filipinos who struggle with their medical bills, they need to reach out to national or local politicians to endorse their case to national government agencies such as the Department of Health or the Department of Social Welfare and Development. Their hope is that the politicians will recommend to the DOH or DSWD a sizable amount that government will cover for the patient's medical bills.
They cannot be the one to directly give the money. They can only give endorsement letters. And they take advantage of that na kailangan mo manghingi sa kanila. That's precisely the design of these programs. It's patronage politics.
Typically, at the end of the process, patients would receive a guarantee letter from the politician, basically saying that the government assumes the obligation to pay the hospital a certain amount through the DOH, DSWD, or some other agency. In this episode, we talk about government assistance programs and how the system we currently have makes Filipinos feel indebted to politicians. For Teka Teka News, I'm Ed Faraon, Puma Podcast. If you look up Medical Assistance Group Philippines on Facebook, you will find a 210,000 member online community dedicated to sharing tips on how you can navigate the bureaucracy of the Philippine government for medical assistance. From the posts, you will find information that can help you determine which politician or government agency is best to reach out to maximize your time, energy, and resources. Magiging kalaban mo una ang oras na maaaring kainin ng mga mahahabang pila sa pagkuha mo ng mga requirements at pangalawa, gastos sa transportasyon dahil maaaring magkakalayo ang mga opisinang kailangan mong puntahan. Hindi ito madali para sa mga minimum wage earners na sinakripisyo na nga ang kanilang araw, mailakad lang ang mga papeles.
Hindi po pamumulitika ang magmalasakit sa ating mga kababayan. Hindi po pamumulitika ang kagustuhan nating mapadali ang pagbibigay ng tulong sa mga Pilipino.
That was Senator Bongo defending the Malasakit Center law, which was signed nearly 5 years ago. The law had aimed to enhance the efficiency of availing medical and financial assistance by serving as a, quote, one-stop shop and linkage between PhilHealth, PCSO, DOH, and DSWD. Sources of funds for assistance include the Medical Assistance for Indigent Patients Program, also known as MAIP, or the Assistance for Individuals in Crisis Situations, also known as AICS. But sometimes, medical assistance from these agencies isn't enough.
Tapos ganyan yung pakiramdam na imbes na ayusin mo yung systematic way of accessing social programs in the government, panglilimusin ka ng mga politiko.
That was former Finance Undersecretary and now UP School of Economics Professor Shelo Magno. She explains how politicians have access to the Medical Assistance for Indigent Patients program.
Ang nakikita kong sistema dyan, nakalagay siya sa budget, tapos ini-earmark siya per hospitals, diba? Or per hospitals or sa DOH. Pagkatapos, may earmarking na dyan. Per senator, per congressman, ikaw meron kang ganito, say 5 million. Mga guarantee letter nila, yung mga endorsement nila, doon ngayon i-charge, doon sa allocation na yun. It's a replacement for pork barrel. They cannot be the one to directly give the money. They can only give endorsement letters. And they take advantage of that na kailangan mo manghingi sa kanila. That's precisely the design of these programs. It's patronage politics.
It's also good to spark conversations about this system as reports indicate that government programs are being used to further political agendas. Take, for example, the recent Senate hearing on the signature campaign to amend the 1987 Constitution through People's Initiative, where Senator Amy Marcos questioned the DSWD about their programs.
Gusto ko lang humirit. Nagulat din ako sa akap at mas lalo akong nagulat sa halaga. 26.7 billion. Isang programa na ngayon ko lang natuklasan at ngayon lang narinig, pero may bilin dito sa text All soft projects, including AKAP, must go through the Office of the Speaker. AKAP, AIX, TUPAD, MAIP for the PI and other efforts.
DSWD Secretary Rex Gatchalian meanwhile denies the allegation that these government programs are being used for charter change. He says the claims will be investigated.
Yesterday, we issued a statement clearly denying na ginagamit ang isa sa aming programa sa People's Initiative. Hindi ho kami humihingi ng karagdagan pang mga requirements katulad ng paglahok sa iba't ibang mga programa or iba't ibang inisyatibo. Ang sa amin, simple lang, kung ano yung kinagisnan yung requirement, ID at social worker intake, sapat na yon para maka-avail ng serbisyo dito sa aming department.
We're pausing for a quick break. When we return, we will talk about improving the healthcare system and how Filipinos can disabuse themselves of feeling indebted to politicians. Pero ma'am, sa tingin nyo, who stands to benefit more from this system?
The politicians. Definitely the politicians, because as I said, there are simpler ways, more systematic ways of doing this. Easier for the public. But we continue to do a system that will inconvenience the public, but at the same time, force those individuals to acknowledge the help of the politicians.
I talked to former Finance Undersecretary and now UP School of Economics Professor Shelo Magno on how politicians take advantage of the medical assistance system we currently have.
Ang problema sa atin, yung mga iba nating kababayan na hindi na-establish yung link na tax payment ko yan actually eh. Naisip nila, napakabait ng politikang to kasi tinulungan ako. Binigyan ako ng tulong without thinking na saan ba niya kinuha yung pera yan? Meron ng taong bayan, tax payment natin yan.
Professor Shelo Magno also emphasized the need to improve PhilHealth to remove indigent patients having to beg for politicians' help.
If you fix PhilHealth, it says that indigent people are automatically covered. So, kung indigent ka, dapat kaya mo na yung i-predict sa NEDA, sa PSA, ilang porsyento ng populasyon natin ang nasa poverty line na hindi kayang bayaran ng premium ng PhilHealth. Subsidized yan ng government. And then PhilHealth as an insurance system should be able to cover yung mga ganitong sakit. Then, you don't need to beg kasi may health insurance. That's first.
Aside from improving PhilHealth's role in providing medical assistance, as compared to the current setup of reaching out to politicians for endorsement, Professor Magno says ensuring access to preventive care is also a cost-effective way to reduce budgetary constraints on the part of the government.
The second would be fixing ano ba yung package ng PhilHealth, di ba? In other countries, they cover not just yung hospitalization, but also yung outpatient treatment, or even before you get admitted in the hospital, may preventive. Kasi nga, mas malaki ang gastos ng gobyerno kapag na-hospitalize na. So you want people to have access to preventive medication para maiwasan yung pagkakasakit. But we don't have that. So ang ating PhilHealth coverage, catastrophic agad eh. Cancer, or kapag na-hospital ka na. Tapos, pag tinignan mo naman yung extent ng coverage, kapag naka-hospital ka na, hindi rin naman ganun kalaki. Kaya ako rin actually gustong i-discuss siya kasi na-experience din naman siya. But last year, when yung panganay namin na-hospitalized, so iniisip ko lang, sa laki ng gastusin, and we went to a public hospital because the assumption there is it's cheaper. And then we have PhilHealth. Pero yung PhilHealth, magkano lang yung PhilHealth? 20 ba? Bili pa parang 6,000 lang. Hindi naman. But our bill is more than 100,000. So like kung iniisip yon, na parang kung kami nga parehas sa kaming may trabaho, parehas kaming professor sa UP. Pero ramdam mo pa rin yung burden ng pagkakasakit. What more yung mga tao na walang pangbayad. Tapos ganyan yung pakiramdam na imbes ayusin mo yung systematic way of accessing social programs in the government, panglilimusin ka ng mga politiko.
To queue up in long lines, to endure the bureaucratic processes of the Philippine government, to beg for medical assistance. This is how resourceful and determined Filipinos are. They would do everything for their loved ones in the hospital. But to simply stop the conversation there would only enable politicians to take advantage of the system and use the Filipino utang na loob culture to their benefit. And that was today's episode of Teka Teka News. I'm Ed Faraon. This episode was edited by Pidoy Blanco. Our Teka Teka News executive producer is Jill Caro, and our senior editor is Veronica Uy. If you found this episode interesting or useful, share it with a friend. Thanks for listening.